नमस्कार दोस्तों, वेलकम टू channel Toxicology on board. Today in this video we'll discuss another important topic, that is nickel carbonyl toxicity. So let's directly dive into the question. This question is taken from ABT recertification question paper, May 12, 2000. The question is, which of the following nickel compound is most toxic? So we need to identify various nickel salts, and out of which salt form of the nickel is more toxic. So we have option A, that is nickel oxide, then we have option B, that is nickel carbonyl, then we have option C, that is metallic nickel, then we have option D, that is the nickel fluoride, and the last option is nickel monosulfide. So the right answer will be in the green text, that is nickel carbonyl. So with respect to that nickel carbonyl, what are the important pages which are given in the place in a short textbook, page number 354. It is discussed under chapter 23, which is part of this toxic effect of metals. So under nickel carbonyl poisoning, whenever this nickel form of the metal, no, whenever it is combines with the carbon monoxide, okay, it will forms a complex. That complex is nothing but your nickel carbonyl. Okay, so later on, once upon heating, no, this nickel carbonyl will decompose and again it will form elemental nickel and carbon monoxide. So in my channel, I have already uploaded some important topics on carbon monoxide, how the carbon monoxide poisoning is there. So read about the symptoms of carbon monoxide poisoning. Okay, coming back to nickel carbonyl. So this form of nickel now, it is very extremely toxic. Why? What are the important symptoms that we can see in the patient who is exposed with this nickel carbonyl is headache, nausea, vomiting, epigastric or chest pain you will be having, and hyperapnea. Since lung is the target organ for this nickel carbonyl form, so there will be difficulty in the breathing, cyanosis. So similarly, like that of carbon monoxide poisoning or cyanide poisoning, cyanosis will be there. Gastrointestinal symptoms and weakness, these are the important symptoms you can find. Then later on, these symptoms are accompanied by fever as well as leukocytosis, so decrease in the leukocyte cells. Okay, and eventually more severe symptoms that you will see is pneumonia, respiratory failure, cerebral edema. There will be swelling in the brain as well as death. Okay, so we will see under this, if you look into this chapter 23, no, toxic effects of metals. This chapter no, discusses different, it has categorized the metals into based on the toxicity. One is major toxic metals, essential metals. They are essential for the body, but they pose some potential toxicity. So essential metals with potential for toxicity, metals which are used for your medical therapy, and there are certain metals which are causing less toxic effects. So out of this, our since our question is with respect to nickel, nickel is causing comes under the major toxic metals. So nickel has multi-target organ toxicity, so that's why it is major toxic metal, because we have seen that it is also causing death. So coming to nickel is also being listed under ICH Q3D. So please read that particular guideline with respect to elemental impurities. So in that also they have listed that nickel is belongs to transition metal series of elements. If you look into the periodic table, no, there is a different periodic table also, different groups will be there, and this nickel belongs to transition group, out of which 10th series it belongs. Okay, so what are the important pages one can read with respect to nickel in our class and textbook? We'll see. So first one is the uses of nickel. Nickel, it is used as a metal alloy. It is used in stainless steel. It's a part. Okay, always stainless steel is, it is an alloy. It is made of various metals, and electroplating plating industry also you will find across. So so particularly those people who are working in risk assessment, no, those toxicologists, they have to see the exposure. One is worker population, another is your general population. So those people, the workers, industrial workers who are working with the nickel, no, like how the exposure is. Exposure is either through inhalation or second one is through skin contact, okay, dermal contact. So what are the various sources of inhalation exposure for the workers is nickel containing aerosols, those workers, dust and fumes, and the skin contact is through those workers who are working in mining industry, milling industry, refinery industry, or electroplating or melting, okay. And nickel is also a part of this nickel cadmium batteries, okay. So for that reason, that is also another source of exposure, dermal exposure, okay. uh, since the nickel is ubiquitous in nature, okay, it is almost found in various salt forms in the nature. So and there is a high chances of general population also to get exposed to this nickel. And what are the various sources of that exposure is, exposure is there but low levels of exposure. Workers though, this high level of exposure of nickel will be there. When coming to general population, low level of exposure. What are the sources are there? Nickel, air. Small amount of nickel is also there in the air, cigarette smoke, water, and food. These are the different sources through which a general population can be exposed to nickel poisoning. So we'll see what are the skin toxicity, dermal toxicity. One because there are two different things of exposure. The acute exposure of nickel will cause contact dermatitis, so dermal exposure. So what is this contact dermatitis is, it is causing around in 10 to 20% of this population. This is causing contact dermatitis. Exposure is through air, as I told you, small quantity amount is present in the air. Liquid nickel solutions, prolonged skin contact. Another source is through metal coins as well as jewelry. So whenever you are wearing any jewelry which is made up of nickel, earlier in the ancient times there were nickel coins were there. So these were also another source of exposure for causing contact dermatitis. Okay. So as I told you, these metals will cause sensitization, also leads to asthma. Okay, so it has been discussed under occupational toxicology about this nickel causing sensitization and asthma. So apart from nickel, other metals are there like chromium, cobalt, platinum, and zinc. So read chapter 34 under occupational toxicology, how nickel is causing sensitization and asthma. Right? Then under the toxic effects of metals only, nickel is also on chronic exposure. This nickel and high doses, it is causing cancer. Two types of cancer it is causing. One is nasal cancer. Okay. Another thing is it is causing lung cancer. Okay. Nickel is a respiratory tract carcinogen. Those workers who are working, so occupational hazard is there for the workers who are working with this nickel smelting or welding, this type of industry. They get regular exposure, daily exposure to this, and it will lead to nasal cancer or lung cancer. Okay. So what are the different salt forms of nickel means? Nickel sulfide, nickel oxide, also metallic form of the nickel is causing this type of cancer. Okay. Then we'll read, in addition to that, under chapter 23 only, that is toxic effects of metal, under page number 356, they have given table 23.2. This table 23.2, no, it will list about the metals, okay, and the various target organs. Okay, so this table in my previous video also I have kept it. So with respect to that, here nickel, three target organs are there. One is CNS, it is affecting your, it is causing nervous CNS toxicity. In addition to that, it is causing lung, that is lung cancer, and it is causing skin. Skin, on the skin, it is dermal exposure, it is causing contact dermatitis. Okay, then we'll read table 34.2 under this toxic effects of metals only. So in this, what they have given is occupational diseases, and they have given organ, which organ it is affecting, and what is a causative agent. So in that, nickel has been listed, and it is causing allergic contact dermatitis upon dermal exposure. Similarly, you read table 34.3. In this 34.3, no, very important, it has discussed about the classification of carcinogen. If you look into this agency, is there International Agency for Research Cancer is there. This is the agency which what will do, it will do some studies, it will classify the chemicals which are having either potential for carcinogen or probable for carcinogen based on either animal trials or the human epidemiological studies. So they have listed nickel as group 1 carcinogen. So go back and read what are the different types. I have kept it here. So group 1 is nothing but it is a definite human carcinogen. So they will have enough human data is there from the observations where we have decided where IARC has classified this nickel as the definite human carcinogen. So in this table 34.3 you can read. So they have given nickel compounds. Those workers who are working in nickel smelting as well as welding, they have done some studies. They found there is a cancer associated with this nickel exposure. Okay, under this toxic effects of metals only, if you look into Clayson short textbook note, at the end of the chapter, they will give you a series of questions. They will give 10 to 12 questions at the end of every chapter they have given. So in that one question is, which of the following is a common symptom of nickel exposure? So we need to identify. So the right answer will be contact dermatitis. So if you read these tables, either 34.2, then you will be able to answer this question. Okay. So now we'll see table 8.8, which discusses which is listed under chapter 8 of chemical carcinogen. So this 8.8 table 8.8 is what it is doing is that it has given the causative agent, industrial process, means the workers are working in which particular area, and the type of cancer which is associated with this causative agent. So nickel has those workers who are working in nickel refinery. There you have nasal sinus as well as bronchus. See, not only that, there is association of this small lung cell carcinoma is also associated with nickel exposure. So pause the video here. Also read about other agents like asbestos. Frequently, they'll be keep asking about asbestos, where peritoneum and bronchus are associated with the cancer. Okay, then we have arsenic, skin cancer and liver cancer is there. Benzene is there, which is causing bone marrow cancer. Okay, chromium and chromium, various oxidative salts of chromium are there, where it is causing nasal cell and bronchus cancer. Okay, wood dust is causing nasal sinus. Also, read about wood alcohol. It's a common synonym name for methyl alcohol, methanol. Then we have other metals like beryllium, cadmium, okay, which are causing bronchus cancer. Ethylene oxide, very important. Okay, common contaminant in the case of cup syrups. So, a lot of questions on ethylene oxide, ethylene glycol you will be getting across. So, that is also causing bone marrow cancer. Okay, so like this, pause the video and try to read about the agent and type of the neoplasma which is causing industrial exposure. So coming to inorganic carcinogens. Inorganic carcinogen means it is in the form of metal. So nickel is associated with uh, this lung and nasal cell carcinoma. Apart from that, as I told, read arsenic, beryllium, cadmium, chromium, lead. All these things are inorganic metals which are causing cancers. Okay, different types of cancers. Then read table 15.1, which is given in the chapter toxic responses of a respiratory system. Since we have seen that nickel as one of the target organ is lung, in that you have seen they have given this table 15.1, they have given toxicant, the type of the disease, exposure, acute effect and chronic effect. Okay, so coming to nickel, the type of industry is nickel mining, smelting, electroplating, battery. So nickel is a component of cadmium nickel battery. Okay, fossil fuel combustion. All this will lead to exposure to the nickel poisoning. Acute effects are delayed pulmonary edema, skin allergy, that is contact dermatitis. Chronic exposure will lead to acute lung injury, chronic bronchitis, non-small cell lung cancer, and nasal cancer. So when it comes to lung cancer, no, there are three different types of cancers are there: adenocarcinoma, squamous cell carcinoma, large cell carcinoma. So read about these things because lot of new drugs are there. Last 2 years, if you look into 2024 or 25, um, where lot of drugs have been approved for this non-small cell cancer treatment by the FDA. So read about the latest 2024 or 25 drugs which are approved by the FDA for the treatment of this non-small cell lung cancer. Okay, so coming to how the nickel is having adverse effect on the immune system, that is given under chapter 12, toxic responses of the immune system. Metals and metallic substances including metallic salts. So they will cause contact that is hypersensitivity reactions and pulmonary hypersensitivity reaction. So nickel is one of the thing which is causing hypersensitivity reaction. What type it is causing means type 4, that is delay type of hypersensitivity reaction, that we will discuss in this slide. So metals, so what is the effect of adverse effects of nickel on the heart? Okay, if you look into this chapter, no, chapter 18, that is toxic responses of the heart and vascular system, in which nickel has been given. So what it will do, it will go and interact with your in the heart. You have calcium channels will be there. This nickel will go and bind with this calcium channels, and it will cause blockage of this calcium channels, because of which contraction of the heart will be affected. So apart from that nickel, pause the video and read about other metals which are causing the blockage of calcium channels. Coming to next chapter 19, that is toxic responses of the skin. So we have table 19.3 in which nickel has been listed. So nickel is causing, it is one of the common allergen. Okay, contact allergen. So apart from nickel, what are the other metals? You read chromium, cobalt, and mercury. How they are the common allergens, contact allergens. Then next, this under this toxic responses of the skin only, at the end of the chapter they have given one question. The question is, nickel is a common cause of allergic contact dermatitis. We need to identify the type of hypersensitivity reaction. We, by this time you have understood nickel is causing contact dermatitis. Okay, so what type of hypersensitivity reaction it is? It is type 4. The right answer is type 4. Type 4 is nothing but, so very quickly we have four types. Traditionally we have four types of hypersensitivity reactions we have. First three are immediate. Last type 4 is delayed type of reaction. Okay, but nowadays we have come across another type of reaction, that is type 5. So you go back and read what is type 5 type of hypersensitive reaction. Also, whenever you read about this hypersensitive reactions, read about the examples. They will ask you about examples like penicillin related hypersensitive reaction is an example for type 1. Okay, poison ivy, Steven Johnson syndrome, all these examples you read. Good pasture syndrome. Okay, so very quickly, type 4 is nothing but delayed type of hypersensitivity. It is a cell mediated immune response. What is happening in this after exposure to the antigen 48 hours or 72 hours, then you will see the reaction. That's why it is called delayed type of hypersensitivity, and it is an antibody body mediated type of reaction. Okay, so here CD4 as a CD8 cell activation will be involved. As I told you, example poison ivy, the plants which are causing this type of that is contact dermatitis, poison ivy you read. Then Steven Johnson syndrome, toxic epidermal necrolysis, okay, which are very fatal. Okay, then graft rejection also examples for this type 4 hypersensitivity. Then we'll now jump into what are the last important pages which are mentioned under toxic effects of metals on the chapter 23. So immune reactions are involved, I told so metals provoking immune reactions, that is nickel is there. Apart from that, you read other metals. Then what is the mechanism? This is very interesting, which I come across in the textbook, is that generally with respect to endocrine disruptors, no, we'll see that endocrine disruptors, they mimic the estrogen progesterone type of hormones which are there in our body. But here I have seen that metals are mimicking. So you read this, metals can show more specific forms of chemical attack through mimicry, acting as a mimic of these essential metals. So what are those essential metals? They will bind to these physiological sites that normally are reserved for an essential metal. By this time you understood that nickel is not an essential metal. It is not an essentially nutritional value, but deficiency will cause some kind of adverse effects in the case of animals. But what is happening, whenever the nickel is there in our body, it is replacing important essential metals like zinc. Okay, and instead of zinc, this either nickel will go and bind, or other examples they have given like cadmium and copper will go and bind. Why? What is the nature means? If you look into the periodic table now, so here you see here if you if you know, nickel belongs to transition elements, and other thing is zinc also belongs to transition, because of the similarity of the nature, no, instead of zinc nickel will go and bind. Similarly, other two examples they have given, that is cadmium and copper. If you look into cadmium and copper, they also belongs to transition series of elements. So because of the similarity in the structure, instead of zinc, these metals, non-essential metals, will go and bind. So that might be the reason for this immuno-related toxicity. Okay, so another important that you will come across is nickel cadmium batteries. Okay, so read about that also. Then in chapter 28, that is under nanotoxicology, they have listed this nickel. Nickel, nowadays they are used it in the form of nickel magnetic nanoparticles. So they have a lot of therapeutic applications are there in the case of pharmaceutical field in the medical diagnosis. So that might be one area of question. Then we'll discuss about the solubility. Based on solubility of this particular nickel, no, highly soluble, less soluble. If you look into the nickel appears to play a role in toxicity of many inhaled metals by enhancing metal bioavailability. So solubility is very important. One of the physicochemical property which will decide. So those nickel salts which are highly soluble, no, they will increase the solubility. Example, nickel from nickel chloride versus nickel oxide. But insoluble can also be a critical factor in determining the toxicity. So if certain form of nickel or other example like cadmium oxide is there, which is less soluble. If it is less soluble, it will remain in your lung for a longer time, increase pulmonary residence time within the lung, because of which there will be more toxicity when compared to soluble salts. So that also you have to remember. Physicochemical properties is going to determine the nature of the toxicity of that particular metal. Okay. Then now we'll discuss some 4 to 5 slides. We'll be discussing on about ICH Q3D guideline. So if you look into this nickel, no, it has been listed under ICH Q3D R2 revision 2 guideline. Okay, so in that they have already given about oral PD value, parenteral, that is injectable PD value, inhalation PD value. They have given, that is 220 microgram, 22 microgram per day, and inhalation it is 6 microgram per day. Okay, so as I told you, it belongs to group 10 element. Okay, transition series, first transition series. We have 4 transition series are there. First transition series it belongs. Okay, this is the first transition series in the periodic table. So generally these metals they exist in different various oxidative states. Nickel exists in 0, +1, +2 and +3. Out of which +2 is the main oxidation state, where ubiquitously you can see this type of oxidative state of nickel. Okay, so various mineral forms it exists, various salt forms it exists, like nickel chloride, nickel sulfate, nickel nitrate, which are more soluble. Okay, and since they are more soluble, they are more toxic than the less soluble forms. Less soluble forms के लिए examples we have nickel oxide and nickel sulfide. So more soluble, more toxic. Less soluble, less toxic. That you have to understand about the solubility. Then um, uh, I missed one point. Nickel, no, it is an important component in the case of inhaler. Inhaler contain meter dose inhalers is there, no? In that one of the component is made up of nickel metal also. So that is another source of exposure. So very quickly we'll discuss about this. How the oral PD value of nickel has been derived by this ICH Q3D. So what they have considered is 2-year cancer study in the case of rats they have considered. Here you can see. So whenever you are deriving risk assessment toxicology, you will see whenever you are deriving a permitted daily exposure for a certain chemical, when you do the literature search, no, you do not end up with the same literature on the same chemical on which you are doing your literature search. So here they were looking for nickel, but they found the studies for nickel sulfate hexahydrate. So as such, nickel के लिए they didn't. There was a data gap on the metal itself. You will not have toxicology studies. So the toxicology studies which they have seen is on the salt form, that is nickel sulfate hexahydrate. Okay, and this was a cancer study, 2-year cancer study in the case of rat. So they have ended up with a LOAEL 10 mg per. They couldn't end up with a NOEL because in almost every all the 3 doses, whether it is 10, 30 or 50, they found um, There was no tumors actually, but there was decreased dose because other endpoints like decrease in the body weight, because of which they considered this lowest dose 10 as the LOEL. So this 10 LOEL 10 mg per kg per day is considered as point of departure for the calculation of permitted daily exposure. Okay, so since we are deriving it for nickel, so the molecular, so we have to apply molecular weight correction factor. Okay, so here nickel sulfate hexahydride is molecular weight is 262.86. Okay, and molecular weight of elemental nickel is 58.69. Then what you have to do? You have to apply molecular correction factor in order to get a LOAEL, that is lowest observed adverse effect level for nickel. So here what how you will get it? Uh, uh, how you will get it? 10 is the lowell for 262.86. So what will be the lowell for 58.86 means 10 into 58.69 divided by 262.86. Then this is your 2.2 mg per kg per day is the lowell for nickel. This is what the ICH Q3D people they have considered as the lowell for your nickel. So now 2.2 into 50 kg is the body weight correction you have to apply whenever you are considering point of departure from the animal study. Here if you look into 10 no F5, they have considered it as 10 higher factor because they couldn't derive NOAL. That is the reason they have considered correction factor F5 is 10 here. Okay, so they ended up with 220 microgram per day. Now we'll see how the inhalation PD value was derived for nickel. If you look into this inhalation, no, here earlier there was hexahydride salt was there. Here they have considered for nickel they have considered nickel oxide study. Okay, so metallic nickel they have considered 2-year nickel oxide and metallic nickel they have considered. So here the value which the Noel from the rat study was 0.5 mg nickel per meter cube per day. So in order to do for continuous dosing, since most of these inhalation studies are 6 hours per day and 5 days per week, so there will be 7-day dosing will not be there because we can't keep the inhalation animals in the restrainer for a long time. So there will be correction will be applied. So 6 hours per day, 5 days per week. So whenever you multiply, you end up with 0.089. So one to convert mg per meter cube to ml per liter per meter cube, you have to divide it by 1000. So they ended up with 0.0089 mg per liter. Now we have to correct it for a daily dosing. In order to convert it to daily dosing, rat, if you look into respiratory volume, which is will be given in the ICH Q3C guideline also they have given, and in ICH Q3D guideline also given. So rat respiratory volume 290 is taken from here, 290 liter per day. And if you look into the body weight of the rat, no, normal body weight is 425 grams, so they have considered in kgs, so divided by 1000, that is 0.425 kg body weight. So if you're taking any embryo fetal study or a fertility study in which rats are pregnant, then you have to consider rat pregnant body weight. Okay, so like that in from this table you can consider. So after applying the correction factors, you end up with the value 6 microgram per day. This was the thing. So very quickly we'll go through. There is a recent revision ICH Q3D R2. In this no R2 revision they have given, in addition to oral, parenteral and inhalation, now there is a something new, that is for cutaneous type of, whenever there is dermal exposure is there, dermal risk is there. So there is a dermal PD is also available in this Q3D guideline. So so whenever there is a revision in the guideline, a document history will be there at the starting pages of the guideline only. So they have given correction for PD for these metals, for gold, for silver and nickel under appendix 2 they have given. So this was updated in 26th April 2022. So please go back and see. And for nickel, no, apart from these three routes, so cutaneous products we have 200 microgram per day, and CTCL. What is CTCL is nothing but cutaneous transcutaneous concentration. Okay, that is 35 microgram per gram. Okay, so how you are deriving this cutaneous PD means there is simple formula. You have to multiply parenteral permitted daily exposure into CMF. CMF is nothing but cutaneous modifying factor. That is similarly like that of bioavailability factor will be there. Okay, so always one more important thing is that two procedure is there. One is PD you will calculate. In this case, they have calculated 50 microgram per gram after applying maximum daily dose. And from the CTCL, they got 35 microgram per gram. So whichever is lower, that you have to consider. So in this case, 35 is lower when compared to 50. That's why they have considered CTCL value, that is 35 microgram per gram. Okay, this is very important new learnings for the people who are um, working in the risk assessment. Okay, so how important last quickly I'll explain. Whenever you're doing dermal exposure, no, there is something unit called fingertip unit. So whatever cream you will take on a fingertip, no, so 1 FTU, that is one finger tip unit, will be equivalent to, here in the guideline also they have mentioned, it is equivalent to 250 centimeter square. So here in the case of nickel, no, so dermal concentration limit is 0.5 microgram per centimeter per week. So this 0.5 you have to divide it by 7. Then you will end up with 0.07 microgram per centimeter square per day. Okay. Then this is multiplying with 250 centimeter square, 1 FTU. So that will end up with 17.5 microgram per day. And here concentration they have already given, which is 0.5 gram dose of drug product on the skin surface. So that's why you have to divide it by 0.5 gram per day. Then that you will end up with 35 microgram per day. So this was a case example how to derive for a dermal type of PD also, considering CTCL value. So hope from this video in detail you understood about the nickel, what are the different target organs are there. So we also contact dermatitis, different types of small lung cell carcinoma we have read, and also we have seen permitted daily exposure, nickel being listed under ICH Q3D, how traditional type of PD is three routes. In addition to that, we have dermal PD also there. Hope from this video you were able to learn about so any question that comes with respect to nickel, we will be able to answer in the exam. Thank you so much. Be curious. For any questions, please write mail to arya.priyanka18@gmail.com. All the best for your exam.